All right. Good evening and welcome to the virtual town hall on reimagining public safety in the city of St. Louis. Thank you for taking the time out of your busy day to be a critical part of the conversation. Your voice must be in the conversation, so thank you for inviting us into your homes, into your businesses, and into your community today to have this very important discussion. I did say your voice was important because we are going to be inviting you to share your questions and your voice into the space today. So I bring you greetings from the ancestral land of the Cheyenne, the Arapaho, the Ute, and the Ute Mountain Ute. And that is none other than Mile High City in Denver, Colorado. Not too far from you all, but I'm so excited to be sharing space with the community of St. Louis today. My name is Claudine McDonald, and I am privileged to serve as your moderator today. Just a few logistics to make our time successful today. Let's do some grounding for us. We are in Zoom world. We are all getting very familiar with Zoom. And so I want to make sure that you have an opportunity to submit your questions because we're not standing in front of you right now. We're using this technology. So in front of you, you have, if you're in Zoom with us right now, you have the opportunity to submit questions by hitting that Q&A button right there in front of you. That will be sent to our amazing production team who's going to be monitoring those questions that come in. And we're going to make sure that we're going to get to as many of those questions as we can, that they're going to go to directly to our panelists who are going to be joining us later in the program. So why are we here? Unless you just have not turned on a TV lately or listened to the radio or read the news, I guarantee you've heard about or probably spoke about this turning point in our public safety systems and structures. Not only here in the city of St. Louis, but really across our country. This conversation, thanks to our leadership, is coming to your community today. So I personally applaud each and every one of you. Next slide, please. First, I want to do some level setting for us. We're going to have to expect and accept non-closure. That's unfortunate that we're going to have to accept this. Okay, just want to make sure we get to that next slide, please. So that non-closure piece is going to be difficult for us, but we're going to want to make sure that we understand that we're not going to be able to solve all of the issues and concerns that come up tonight for us. This is going to be a starting point for our conversation. Our objectives are threefold. You'll see them on the screen in front of you. First, there was a public safety assessment and policy and analysis partnership between the Center for Policing Equity, the City of St. Louis, that was conducted by and through the Department of Public Safety. We have some results of that partnership and some recommendations that we want to share tonight with you. We aren't going to have enough time to really go into all of the details and really dig deep into the details, but the amazing team from the Center for Policing Equity will be sharing the findings and making some recommendations. Second, we want to introduce this new partnership to the community so you have a better picture of what's transpiring in your city. This collaboration of reimagining public safety is in partnership and participation of the Department of Public Safety and the Office of the Mayor, along with the Center of Policing Equity. Center for Policing Equity is going to outline the work that has already been done, and we'll discuss next steps. As a community, I know you want to hear what's next, and that's exactly what you're going to be hearing on tonight. And third, we need your voice, the community, the people of the city of St. Louis. We are here tonight to allow you to speak your truth. You play an integral role in forward progression, and these great minds have assembled to give you that space to do just that. They want to collect feedback from you on the recommendations that are going to be presented to reinforce the message that this effort is part of a broader change in St. Louis's public safety approach and priorities. I would say this is the most important part, and it's your voice, the multiple perspectives of our community. Next slide, please. In front of you is our outline for this evening. We will move swiftly through this agenda, so make sure you take a quick look at it, take a snap of it with your phone if you want to, but we are definitely going to move swiftly through this agenda in order to get to the panel discussion and the Q&A portion. So I encourage you to listen mindfully to each of our panelists and write down your questions. When you have a question, submit it to the online through the Q&A portion of Zoom. And when our production team is going to be receiving those and waiting to hear from you. And I want to get started with those introductions quickly. Next slide, please. Here's our esteemed panelists. First, we have Dr. Hans Menos. He is the Vice President of the Triage Response Team at the Center for Policing Equity. Next, we have Dr. Rob Kenter. He serves as a Senior Director of the Triage Response Team, also with the Center for Policing Equity. Next, we have Hillary Rao. She is the Vice President for Policy and Community Engagement, also with the Center for Policing Equity. And next, we have Dr. Lucy Odigi-Turley. She serves as the Senior Director of Editorial and Narrative Strategy at the Center for Policing Equity. And then there's yours truly. I'm an Equity Transformation Specialist with Courageous Conversation. We are a global consulting firm committed to achieving racial equity in the United States and beyond. And I have the distinguished privilege of serving as your moderator this evening. Next slide, please. So again, thank you to our panelists. I want to make sure that I bring in the right person. I want to remind our viewers that we have questions. If you have questions as we go through on this evening, write them down, send them forward because our production team is waiting to hear from you. Again, your voice is going to be the most important part of this evening. I want to make sure I turn it over to Dr. Hans Menos from the Center for Policing Equity. Please, Dr. Menos, bring your voice into the space.
Thank you very much, Claudine. I appreciate you and your kind words. Hi all, Hans Menos from the Center for Policing Equity. Who we are, we're an organization focused on racial equity that believes that we can use data as a lever for social change. We were started 10 years ago by Dr. Phil Patipagoff and Dr. Tracy Cassie, then Chief Tracy Cassie of the Denver Police Department. So our efforts in the city of St. Louis have been focusing on the idea of reimagining public safety. But first, it's important to understand what it means to reimagine public safety and understand that the idea is that we cannot just consider policing to be public safety, and that we have to reimagine and what we could include in our public safety systems, and that reimagination requires reflection and innovation. Next slide. At CPE, we talk about reimagining public safety in really two distinct ways. We believe that we have to improve the systems we have while we build the systems that we need. The improving systems that we have, that's our harm reduction. You're going to hear about some policy changes and other things that would improve the current structure of public safety in the city of St. Louis. But we're also going to talk about some reimagining, some new systems that can be built in the city of St. Louis. And those are the recommendations that we consider reimagining public safety. Next slide. And now I'll hand it over to Dr. Lucy Odigi-Turley. Go ahead, Lucy.
Thank you so much, Hans, and everyone for joining us this evening. I'm Lucy Odigi-Turley. I am the Senior Director of Editorial and Narrative Strategy at CPE, and I'm just going to spend a couple of minutes walking you through some of the top line takeaways from our analysis of St. Louis Metro PD's police administrative data as part of the National Justice Database. So the National Justice Database is the nation's first and largest database tracking police behavioral data. Next slide, please. So CPE analyzed administrative data provided by the department between 2012 and 2019, specifically pedestrian stops, vehicle stops, and use of force. So what did we find? Our analysis for pedestrian stops, we found that Black pedestrians were 2.3 times more likely to be stopped than white pedestrians, and this is on a per capita basis. Racial disparities were also most pronounced in more affluent neighborhoods. So this is when we examined neighborhood factors such as crime rates, poverty rates, and neighborhood demographics to examine their potential influence. Reported pedestrian stops also decreased by 82% within the study period, but really important caveat that St. Louis Metro PD does not require the recording of pedestrian stops. So this decline might be a decline in the reporting of pedestrian stops as opposed to an actual decline in the number of stops that took place. For vehicle stops, we found that Black drivers were 1.8 times more likely to be stopped than their white counterparts, and that reported vehicle stops increased by 12% during the study period. And that study period for vehicle stops was between 2016 and 2019. And finally, for use of force, we found that Black people were subjected to force 4.3 times more likely than white people, again on a per capita basis, and that reported use of force incidents decreased by 18% within the study period. So this is just a snapshot, really high-level takeaways. For those of you who are interested in examining the full report, it is available on the stlouis.gov website. And with that, I'm going to hand it back to Hans.
Thank you, Lucy. So at CPE, one of the cornerstones of the work that we are trying to accomplish is ensuring that the community is centered in all of our work. So our team, our community engagement team and other teams worked really hard to understand the community perspective in St. Louis. It's important to know this is ongoing work. We don't believe we fully accomplished this or fully saturated, but we did come away with some high level takeaways that I'll discuss now. One of those is that there's an inequity between North and South St. Louis. Obviously, that's not surprising to many people in the city of St. Louis, but the idea of the Delmar divide was consistently referenced in our work. And I apologize for the background noise. It's bath time over here. Additionally, there's a desire for increased investment in alternative response models. Some of this work's ongoing in the city. There are teams that are actively working, the purple shirts, the crew teams that are out in the city. And we're going to talk some more about some recommendations that are additional alternate responses. Next slide. There's a desire in the city of St. Louis among the residents for some additional investment in our education and youth programming. The idea that young people don't have enough opportunities during out of school time to really get everything they need and to be fulfilled in both an educational and non-educational spaces. Additionally, as everyone knows, everyone who follows the news in St. Louis is aware, there is a sense that the Civilian Oversight Board is understaffed and lacks the sufficient power to meet the needs of the residents. Next slide. Finally, so in addition to those findings, the residents of St. Louis highlighted that they feel unsafe when interacting in the streets of the city. They don't feel as if the traffic safety is where they would like it to be, and are asking for additional responses to traffic safety, and wanted to highlight especially that they're not solely focused on a police response to some of these issues, and wanted to really think about how traffic safety can be accomplished without solely relying on old tactics and policing. And finally, the residents were clear that they wanted a better community engagement by both the police department and their general city government. They wanted that to include updates on decision-making around policies and why policies existed, and they wanted that information brought to them. They weren't necessarily looking to be invited into spaces. They wanted their government, their police department, to push into spaces that they already are in. But that could be houses of worship, that could be community rec centers, but places that people are already naturally gathering was one of the desires that we wanted to uplift. Next slide. And now I'll pass it to Dr. Rob Kenter. Go ahead, Rob.
Hi, good evening, y'all. So CPE conducted a rather comprehensive scientific evaluation of St. Louis Police Department's calls for service. And one of the key findings is that low-level calls for service generate the largest number of use of force incidents, as well as the northern part of the city experiences a less responsive police service. For example, they have slower dispatch times, and they have a more capita-initiated nuisance calls, officer-initiated calls that are nuisance type, low-level calls. Next slide, please. So here's a good visualization of the use of force incidents broken down by patrol district. As you can see, the bottom part of the screen represents districts 4, 5, and 6, the northern half of the city. And that red is the officer-initiated calls for service that result in the use of force. And on the top is those low-level calls I was just speaking of. That low-level calls, low-level pedestrian stops more than likely result in a great deal of use of force in the city of St. Louis, specifically in those northern 3 precincts or patrol districts. Thank you. Next slide, please. So those census tracts with more Black residents experienced a less responsive police service than the rest of the city. When I say that, examples would be they have to wait longer for a police officer to respond to their needs. And like I said, those nuisance calls happen more often. Those officer-initiated nuisance calls, like loud noise, is a prime example of nuisance calls. More prevalent in the northern half of the city. Next slide, please. So, in addition to looking at the calls for service, we also looked at the staffing of the St. Louis Police Department, and we partnered with the Matrix Consulting Group, which is an organization that specializes in public safety workload and staffing. There's not a whole lot of people that do this work, and the Matrix Consulting Group, the folks there do it very well. So the key findings when I looked at the staffing analysis based on workload is that there's significant opportunities to divert some of these calls to a non-sworn, unarmed responder that can handle it outside of the police department. They also recognize there are significant imbalances across the city in police staffing versus as compared to the workload. So that not only in the patrol district, but also at the shift level. And there's a good visual in the next screen. Next slide, please. So when I talk about call diversion, there's some really good opportunities in St. Louis to divert calls away from the armed responders in the police department. At CP, we like to say that by taking the police out of those spaces, by reducing the police footprint, by taking them out of the spaces that they're not the best government agency to deliver services, we can reduce disparities by proxy. Just by taking them out of those services, we can reduce some of the disparities present in the police department. And also across the country, we're seeing that staffing is an issue. The human capacity willing to do police work is reducing. There's not a whole lot, and St. Louis is feeling that burden as well. So by taking some calls away, we can add to that staffing problem and kind of reduce the issue there. Next slide, please. So the Matrix organization has done work across the country, and based on their work and what other cities have done, they identified 19 incident types that could be partially or wholly transferred or diverted to unarmed responders. And that equals almost 1 in 5 calls for service that the St. Louis Metro Police Department responds to. So 1 in 5 calls possibly could be diverted to an unarmed responder. Next slide. So here's that visualization I was talking about. As you can see, the workload, say the 3rd Patrol District, although it's not even across the day and it's not even across shifts, they have enough staffing there to handle that work. However, you compare it to the 4th, someone in the north side of the city patrol district, this is when, due to that staffing issue, you find a less responsive police department, a less responsive patrol district. They just can't handle the call volume. Calls stack up, and they don't get, the women and men in the St. Louis Police Department don't get to spend as much time responding to those calls for service as they would like to. Next slide. Let me hand this over to my colleague, Hillary Rao.
Thanks, Rob. So I'm going to talk about the policy review component to our work with the city. At the city's request, Center for Policing Equity reviewed the police department's written policies on use of force, pedestrian and vehicle stops, and crisis intervention. And the goal of this review, particularly for the use of force and pedestrian and vehicle stop policies, was to identify opportunity to reduce the risk of disparities in those outcomes through changes to written policy, based on what we saw with the results that Dr. Odigi-Turley went over earlier. The crisis intervention policy work, which I'll be discussing a little bit later, was undertaken in participation with a really great existing community working group that had members from the mayor's office, the police department, BHR, and other community stakeholders as well. So key guiding principles that we use to guide our review is, number one, that behavior is more strongly affected by situations and policies than by individual attitudes. And secondly, that restrictive police policies have repeatedly been found to be associated with lower rates of force and more equitable outcomes. So when we approach a review, we are really looking for an opportunity to set situations and policies in place that are restrictive and clear in order to reduce risk of disparities. So first of all, we have a lot of recommendations here. I'm going to go over them at a high level rate and then pass off to my colleague, Hans. So first of all, we want to make sure that these policies are transparent and that the public has access to them. So first of all, we'd like to see the department adopt a unified system to store and update all of the current policies and to publicly share all of the current policies on the website so that anyone can access them, and to share these policies for community input anytime they're being updated, including proactive community outreach. We heard a lot from the community about concern about the efficacy of existing civilian oversight systems. So we're recommending that the city convene a planning group to follow up on those concerns and to investigate whether there are opportunities for improvement. In light of what we saw in our analyses, both with respect to disparities in vehicle and pedestrian stops, as well as the high rates of use of force resulting from officer-initiated low-level stops, we're recommending that the department adopt a policy ending the use of pretextual stops, which are stops that are initiated ostensibly based on a minor traffic violation or civil infraction, something like jaywalking, for example, but that are actually motivated by a desire to investigate a crime for which the officer lacks evidence to stop someone. So we are recommending that the department adopt a policy ending use of pretextual stops as a tactic. In order to ensure whether this policy change or any of them are working, we need to have good data. So as mentioned earlier, the department is not currently requiring collection of data on all pedestrian stops. They do require it for vehicle stops. So we are recommending that the department begin collecting data, requiring officers to collect data on all pedestrian stops and to enhance their procedures for routine analysis of stop data to ensure that they are identifying potential threats to equity and addressing those promptly. Next, we look at the department's use of force policy. And at the outset, I just want to highlight that one of the most important ways to prevent use of force incidents and incidents of excessive force is to make sure that the incidents that are leading to force aren't happening to begin with. So all of our work around avoiding pretextual stops and all of our work around crisis intervention is also something that contributes to an overall approach to reducing use of force. But we also want to make sure that the use of force policy itself is strong and clear and sets some restrictions on that align with what the community expects of its officers. So first of all, we're recommending that the department adopt a unified use of force policy that contains all recent revisions. Currently, the department's use of force policy exists in a couple of different documents, some of which supersede others. We'd like to see that combined into one clear document. We'd also like to see the policy amended to require that use of force be proportional to the threat level faced by the officer, and to see clearer, more mandatory criteria for when medical aid needs to be summoned after a use of force incident or other encounter with a member of the public. We'd also like to see clarified and expanded policy language on neck restraints and positional asphyxia, and updated language further clarifying rules relating to use of OC spray and tasers. The work of the Crisis Intervention Team Policy Working Group is ongoing, but we've made good progress on identifying issues that we want to make sure are covered in an updated CIT policy. Really, at this point, the work has evolved beyond just looking at what a crisis intervention team policy would look like, and is focused more broadly on what a policy on interactions with people experiencing mental health crisis should look like. So we are in the process of building out a model policy that would, a draft policy that would include all of these elements, and also looking to expand the group's effort to include review of policies of additional stakeholders like dispatch, hospital, or VHR, to make sure that those policies are all aligned and that we are maximizing all of our opportunities for diversion. We're also recommending procedures to support dispatch to ensure that the right people are getting to the right call. So that can look like exploring technology systems to allow officers, dispatchers to determine which officers have certain types of training, and also having dispatchers expressly inform callers of the availability of mental health response services. So for example, there are cities in which dispatchers will answer the phone 911, do you need police, medical, fire, or mental health services? And just the mere fact of offering that additional service increases significantly the number of people who take up that offer. And now I will hand back to Hans.
Thank you, Hillary. So this next recommendation is focused on transparency and accountability, and specifically on the body-worn camera. The body-worn camera was introduced as an accountability tool. Folks around the country and many municipalities around the country focused on the idea that if we put a camera on a police officer, accountability would rise. Unfortunately, there's not enough back-end systems to really utilize this camera in the way that it probably should be utilized. So our recommendations do focus on some of those goals. That includes using footage as a training tool, developing a rubric for procedural justice and scoring individual officers on that rubric, and finally, publishing de-identified results of any body-worn camera audits that are focused on procedural justice. Next slide. As Rob mentioned, there is a lot of opportunity, somewhere around 20% of the calls for service that this police department experiences can be answered or could potentially be answered by folks who are not police officers, not people with badges and guns. This could free up police officers to do other activities and would also provide the residents of the city a different level of service, different level of care, a system of care that could respond to everything, all their needs in a more appropriate way. These officers could be called CSOs, community service officers, or could be some other title, but should likely exist outside of the police department to ensure that that they are providing or are responsive to the residents of the community, of the residents of the city. Next slide. So on staffing, aligning the patrol staffing with the workload. So as Rob mentioned during while covering his slides, there's an imbalance in terms of workload, but the staffing is flat. So the recommendation is to ensure that we are appropriately staffing the St. Louis Metro Police Department to include when they're the busiest, at what time of day, and to include what districts need more police officers in that district. We want them to formally track the workload and adjust it accordingly based on the workload as it comes up. Next slide, please. Acoustic gunshot detection. That's technology that exists in the city that uses a sensor or a microphone to identify gunshots in the city. What we understand from existing research in the city is that the response to this from patrol may not be increasing public safety. It may not have an impact on public safety. However, the response for a investigative standpoint may be useful. But there's not enough data on that. So our recommendation is to reconsider and evaluate the practice of responding from patrol, and also measure the impact of this particular technology on investigations. And finally, to inform communities where these microphones are, where these sensors are, so they're aware of the technology that's in their communities. Next slide, please. Our recommendations on intimate partner violence and family violence. The general idea is that this is a significant problem within the city of St. Louis and many other cities. There are thousands of calls per year for service focused on IPV, and we recognize that there should be additional wraparound services and better connection between existing services in the city and the frontline responses that are responding to these calls. And just from a service standpoint, some effort to identify how many of the calls are intimate partner violence and how many of the calls are focused on family violence. So we can better connect services to the residents of the city. Next slide, please. As I noted, community engagement is a significant issue in our findings. And so our recommendations are really grounded in the recommendations of the community, that we evaluate the success of efforts, that we focus on engaging people where they are in the community and going to them, and focus on engaging more vulnerable members of the community. Racial minorities, the unhoused population, et cetera, are folks that we want to make sure that the community outreach is especially targeted at, and there's a special effort to reach them. Next slide, please. As I noted, opportunities for young people are considered by residents of the city as public safety, and CP applauds that. The general idea that we need more systems of care for young people as opposed to systems of punishment is applauded. And what residents of the city are asking for, and what our recommendation is, that there's more opportunities for youth during out of school time. But moreover, in keeping with our community engagement recommendations, there's efforts to really inform people about how this is either free or there could be scholarship provided, how transportation can exist, and general communication with community about the existence of these out of school time programs to really drive attendance and participation by families and young people. Next slide. Okay, so our final recommendation here is focus on the Public Safety Collaborative. This is a collaborative of residents in St. Louis, of community groups in St. Louis that could be activated to play a role in public safety. This group will be powered by specialized software, RTM DX software, that focuses on the geography of the city, the landscape of the city, and powers a group that wants to respond to this tech. Specifically, what the tech would do is identify opportunities for crime and disorder and provide proactive opportunities for residents to respond in a way that is appropriate. So to be very clear, what the tech would do is identify certain things that, when together, create opportunities for crime. That could be, for instance, a vacant lot adjacent to a bodega that's adjacent to a school, and identifying that when those two things are together, crime is more likely to occur, and dispatching people that are not necessarily police officers to engage in that, and to engage in something proactive to address those issues. That can mean sending a crossing guard to ensure that young people who are leaving school are not engaged in any activity that they should not be, sending someone else from the city to seal that lot and ensure that there's not access available to that lot, to thereby preventing people from engaging with it, and sending a trusted community member to engage a bodega owner to talk to them about what their role could be in public safety. What's important to know about that is that all those folks are activated and engaged without necessarily relying on the response to police. Police could be at the table, police could be engaged when necessary, and there could be a lever that the folks can pull, but that would be a decision driven by the community. We recommend this because the residents in St. Louis are already very engaged and very active. All this would do is take this existing activation and create an opportunity for them to act on actual data and be responsive to that data. Next slide.
And here we are. Thank you, presenters, for outlining the process that you went through, the findings, and also going through each and every one of those recommendations. Many times what we find is when someone presents us with perhaps an area of improvement, they don't necessarily substantiate it with recommendations, but what I see are very attainable recommendations outlined for the people of St. Louis to now review and now question. Is this really getting us to the reimagining that we want to think about? And is it what we need? So let's get to our panelists for our discussion on this evening. Our panelists this evening include the 47th Mayor of the City of St. Louis, the Honorable Mayor Tashara Jones. Mayor Jones has a laudable biography. She served from 2008 to 2013 in the Missouri House of Representatives, graduated from accredited institutions. But what I have admired about Mayor Jones after learning more about her is her innovation in programming and tenacity to face issues head on. Thank you for being here once again, the Honorable Mayor Tashara Jones. Next, we have Dr. Dan Isom, the Director of Public Safety for the City of St. Louis. Dr. Isom is a former Metropolitan St. Louis Police Department Chief of Police. He is an adjunct professor at the University of Missouri, St. Louis Department of Criminology and Criminal Justice, and at the Washington University St. Louis Brown School of Social Work. Dr. Isom served as a public safety director for the state of Missouri during the Ferguson crisis and co-chaired the working group on citizen law enforcement relations as a member of the Ferguson Commission. Welcome to you. And our third panelist on this evening is Jessica Myers. Jessica is a project director for the St. Louis Area Violence Prevention Commission and previously worked for 14 years doing direct services with victims of violence. She's also a doctoral candidate at St. Louis University with research interests including police legitimacy, community cooperation with law enforcement, and hate and bias crimes. Thank you so much for being here. A quick reminder to our guests, if you have questions or for our esteemed panelists, please submit them in the Q&A. You'll see that there. And I welcome each of you. Thank you so much for being with our community on today. I want to jump right in. Mayor Jones, again, you weren't here for introductions. My name is Claudine McDonald. I'm with Courageous Conversation. It's so wonderful to be in your presence. I want to start a question off directly to you, ma'am. What we've seen, we know the work that you've been doing has already begun, and to make policing more equitable in the city of St. Louis. There was a lot of information presented. So can you tell us, how are you reimagining public safety for the city of St. Louis? And how does this data and these recommendations fit into that thinking, or does it? Do we need to start over? Can you lean in a little bit for us, Mayor?
Yes, well, thank you for having me. Good evening, everyone. So I have seen this presentation a couple of times, and I came away from it with a sort of revelation that some of the things that I said on the campaign trail were actually true. That St. Louis has more police per capita than any city our size. And it's not about just having more police officers. It's about deploying the resources that we currently have, and also making sure that we get the other resources that we need so we can deploy the right resource to the right call. And we've already started down that road with our partnership with Behavioral Health Response, with our Cops and Clinicians program and our 911 diversion program, with our focus on diversion, intervention and prevention, with our intervention programs through Cure Violence and other community partners like the Organization for Black Struggle, the Urban League, and too many other community partners to name. And then also our movement towards, with the CRU units, which is what we call Cops and Clinicians, moving towards a civilian response for low-level calls. Again, emphasizing that we are deploying the right resource to the right call. And a lot of this data pretty much underlines several of my theories, that if we have to be smarter on crime and not work harder. I always tell my staff all the time, work smarter, not harder. And how can I provide the resources for you to work smarter and not harder? And this particular presentation also lets our officers know that we are trying to lighten the load for them and lift the burden. Our officers are called for a myriad of things, and a lot of times they're not equipped to handle that. So how do we transform our public safety system so when they are called to do the work that they were trained to do in our academies, and that we are building a new muscle, so to speak, for others for other things when we can deploy the right resource to the right call.
Thank you so much for that, Mayor Jones. And what I heard you say was, you talked about that muscle memory, building up perhaps a different muscle memory than what was previously in place. And then also the right response for the individual call, to make sure that we're utilizing our resources appropriately. Work smarter, not harder. Thank you so much for sharing that. I appreciate you bringing your voice into this space, and I appreciate you for being here. We know that you're very busy. The next question I have is for Dr. Isom. Welcome again also to you for being in the conversation, sir. Thank you for taking the time to address the topic. Public safety is literally in your title. It's what you do on a daily basis. In preparing for this evening, I watched a few of your videos online where you give regular updates to the community on the safety of what's going on in the community, what's actually transpiring in the community. In essence, what this entire conversation tonight is about is reimagining your world. There was a quote at the beginning of the presentation that we shared, and it's a quote by Dr. Goff, and it said, "For 250 years, the system has worked as intended, and that should inspire change." What are your thoughts on the recommendations and change needed in public safety? Dr. Isom.
Well, I think it's important that we recognize that many problems that happen in the community do not require a police response. And for many years, the tool that we have used to deal with many problems in the community, whether it be the family, whether it be juveniles, young people, the home, has been a police response. And so, as the mayor indicated, it's been a huge burden on law enforcement to deal with issues that really should be in the realm of the community. So, as Dr. Goff said, we have created an infrastructure to respond to non-law enforcement, non-criminal issues with a criminal justice response. And so what we're saying is that there is a different way to do that, and that we want our officers to focus on violent crime, serious crimes, and we want to lean into providing sort of the social service network that really can uplift young people, that can uplift communities and uplift families in a way where we use the least amount of force necessary to accomplish that. And if we don't need to use sort of the criminal justice apparatus at all, then that's the direction that we should be headed in.
Thank you for that. What I heard you say was, and you reiterated some of these disparities that were shared in these recommendations. And you said there's been a burden on the law enforcement system so far, and that perhaps that we're sending out the wrong, you accepted and agreed with that quote from Dr. Goff and said, hey, maybe we do need to look at this change right now, because we're sending out perhaps the wrong response right now, because that's what the community has been saying. And that's also what you're agreeing to. Did I hear you correctly, Dr. Isom?
Yeah, absolutely. The system has been designed to deal with community problems through law enforcement. And that has produced a disparity, especially in the Black community, that has had challenges, historical challenges, that are not really things that can be fixed or repaired by law enforcement. And in some cases, it makes the conditions worse. And so we're really trying to parse through, when do we really need the criminal justice system for a public safety need, right? To make people safer. And that is the true question, is that we want to go in a direction where it's absolutely necessary that you need a police or criminal justice response to deal with a problem.
Right, and thank you for sharing about these racial disparities. And I know you had said that you want to, and I'm pulling this from your previous statement about uplifting families and uplifting communities. Mayor Jones, did you want to chime in on this conversation and perhaps respond to what Dr. Isom has stated?
I think Dr. Isom is right, because if he wasn't, I wouldn't have hired him as my public safety director. No, but all jokes aside, one of the reasons why he is in this work is because he has a wealth of experience in leading with prevention. When he was police chief of our city, that was one of the only times when we saw a decrease in crime and violent crime under his leadership. And so I am just ecstatic to have him on my team so he can further continue the work that he was doing as chief and now as public safety director, and using all of the tools in the tool belt, so to speak, or the toolbox to decrease crime. And we've already seen it just in the first 11 months that we've been in office, that we've seen a 25% drop in violent crime and homicides since we took office. And we don't think that this is an aberration or a blip. We are leading with prevention, and we're using all of our resources to deploy the right resource to the right call. And again, also looking at the root causes. We have to look at solving the root causes of crime, because if not, we're just treating the symptoms.
Sure. Thank you for leaning in onto that question there, Mayor Jones. want to go now to our next panelist. Thank you for being here, Jessica. Ms. Myers, your expertise in this conversation is very important. So as you reflect on the presentation, it's important to have these multiple perspectives. Can you bring your voice into the space and share with our community what you feel is the most important recommendation that you heard? And do you think there is one that's missing? And I'm going to add a little bit to that. And what role can the community play in implementing these recommendations?
Absolutely. And thank you for having us. We are privileged to have been part of the conversation with CPE, and we look forward to the implementation of some of these recommendations. Whenever we're presenting about prevention, we always start with a quote from the Prevention Institute that talks about how the drivers of violence are multiple, complex, and often interrelated. So no single recommendation, no single program is going to solve the violence issue. And so I think the important thing is not to pick out any particular recommendation, but to point out how these recommendations echo a lot of what we've heard when we've done community engagement. In our police legitimacy survey, we heard from community that they wanted alternatives to a police response. We heard from both police officers and community residents that they wanted meaningful community engagement that's driven by what residents want and need from police. And that the traditional kind of coffee with a cop tends to be police officers preaching to the quiet folks that are already police. And that if we want to change the hearts and minds of folks that may not have a positive impression of police, we need to really look at community engagement. We also heard in the Youth Violence Prevention Partnership Safe and Thriving Strategic Plan, going back to 2016, 2017, 2018, that youth don't feel like they have safe spaces in their neighborhood. Either the places that should be safe, like parks, aren't safe, or the places that are safe, there are barriers, whether it's transportation barriers or they don't feel welcome. And so we also, we have started to dabble in using the risk terrain modeling software that CPE mentioned. And that's how we were able to find that in the city of St. Louis, if you are north of Del Mar and you're within 450 feet of a vacant lot, your risk of being a homicide victim goes up almost 11 times. And that's not taking any of those other factors into account. And so, we've really seen a lot of this. And that's not to say that VPC has the answer. In fact, it's to say that we see these things coming up over and over again. And so really focusing on what are common recommendations that are coming up from different reports. This expansive notion of public safety, that it's more than just policing. It includes vacancy, it includes schools, it includes youth programming. And then also to really focus on implementation. I think we're really good in St. Louis at creating reports and then putting them on the shelf, especially if there's a change in leadership. Which I know is not unique to St. Louis, but we have observed it in public safety for years. And so this is really an opportunity to look at the overlap between the CPE recommendations and recommendations from other reports, and to go moving forward to really figure out an implementation strategy, an all hands on deck implementation strategy to reduce the impact of violence in St. Louis.
Thank you, Ms. Myers. You said a ton right there, but I want to reiterate what I heard you saying is that the work that was being presented on tonight and the recommendations for the Center for Policing Equity really complemented the work that you've done and the work that you've seen the community, what the community has been saying. That we want meaningful community engagement. We want there to be, we don't want this to be a binder that sits on the shelf. We want it to have some long lasting life. We want it to stick around. Not saying that Mayor Jones, you're going anywhere anytime soon, but we want it to have a long shelf life, right? We want it to be enacted. We want it to be ingrained in the work that we do here in the city of I'm talking like I live there now. I'm going to move to St. Louis, but we want it to be really ingrained in the work that we're doing in the city of St. Louis, right? This is what the community has been saying. And now, here's another recommendation coming forth to say, yes, exclamation, underline, italicized the words, it's happening yet again. The community is saying the same thing. Did I hear you correctly, Jessica?
Absolutely.
All right, wonderful. Thank you. So we're going to make t-shirts that say no more binders. We want this to have a lasting lifetime, right? We want the community to be proud of what we're reimagining here. All right. I do have a question that came in from the audience, and I want to share this. And I'm going to guess that it's going to go to Dr. Isom. So Dr. Isom, can you walk us through some of the pros and cons? And I'll open this up to anybody if anybody wants to grab this, but can you walk us through some of the pros and cons of moving towards a community service officer or civilian responder model? What are some of the pros and cons there? And this, again, I open up to anybody. Dr. Meadows, if this is for you as well.
Well, some of the pros of it is that we've talked about the fact that officers need to be focused on serious crime issues. Generally, that's what the public wants us to focus on. And serious crime issues take a considerable amount of time and resources for officers to do it effectively. And so that's one pro of it. The other part is that many of the low-level problems are beyond the scope of training and expertise of law enforcement. Young people who are having, problems going to school, traditionally, that's been a police issue where we give a summons to the parents for truancy, or we give summons to the child. Is that necessarily a police issue? Could someone else, the school in partnership with someone else, deal with that? Families that have problems within their home, certainly if there's violence related to it, there may be a police response. But if there are family problems that can be handled in a different way, then why wouldn't we try to have a different type of sort of service that could reduce the problems inside that family? So, I think that there are a lot of pros to it. The difficulty, the cons to it is that the infrastructure for that type of response has not been a part of communities. And so the challenge is that we will live in two worlds until we can build up the social service network as strong as the police network. But what I will say is that I firmly believe that we need to invest more in providing these services to families and communities just as much as we have invested in police. The other issue that I will talk about is substance abuse. Substance abuse, homelessness have been something that police have dealt with for years. But you could ask anyone in, about alcoholism or, any drug abuse. Do we have enough beds? Do we have enough places where people who have these types of problems can go to? No, we don't. That infrastructure is not there. So the challenge, the cons of it is not necessarily as a con, but the simple fact is we need to find the structure and the funding to support these things that could have a lasting impact and deal with those root causes that the mayor talked about.
Mayor Jones, did you want to add anything to that response?
No, but I do want to point out something that Jessica mentioned that I think gets overlooked a lot, which is our children and our youth and providing opportunities for our youth. And just last summer, we stood up the Downtown Engagement and Public Safety Initiative. And that is a partnership between private business, the city of St. Louis, and others. And what we focused on, was not only just a temporary increased response downtown, it was also how do we stand up programs for our young people who at the time were just being dropped off downtown with nothing to do. And that's indicative. What we did last summer was just like the tip of the iceberg of a larger a problem that we have in our communities. Because I look back when I was a teenager, I know that wasn't just long ago, but I had places to go. There were teen clubs and there were skating rinks and other activities for young people in that sort of 14 to 20 age bracket. Those things aren't there anymore. And so they are making things up as they go along. I think it's our responsibility, meaning the city as well as private industry, to stand up opportunities for our youth to engage in safe and fun activities and maybe learn something in the middle of it. So we are committed to making sure that we still have activities this summer for our young people to find, so they can have fun and find something else to do besides what I always say, an idle mind is a devil's workshop. Well, an idle downtown or an idle neighborhood is a troublemaker's paradise. So we have to, it's a both and, it's not an either or proposition.
You took the words right out of my mouth. You must be in the church as well, because I don't mind. That's what they say. I'm a pastor's wife. So that, you hear that terminology quite a bit. And I want to get back to what you said, Dr. Isom. You really brought up some amazing pros and cons for us to really think about. And I know with some of the police department that I actually had some time to work with, we talked about sending uniformed police officers to do, to work with our unhoused neighbors and to do these abatements, and how a lot of our officers saying, hey, I'm not sure I'm specifically skilled to do this. I'm not sure this is the right use of my time, when we're being also called, and we may be short staffed, to go to a violent situation, a call that has come in. And so when you have those conversations about the pros and cons, this is the type of conversation that seems to come up, I think, oftentimes. Would you agree?
I would agree. And, over the course of the years that I've been in law enforcement, this is something that the police department and police officers have asked for years. And so, they are a part of this reimagining process, because for many years, they felt that they have had to respond to calls that really weren't police related. And so, the unhoused takes a special skill. It takes special resources to be able to deal with the challenges of the unhoused. And so officers are putting a Band-Aid on the situation. And as I said, oftentimes maybe making it worse than could be if there was the right professional who could respond and provide substantial care to individuals.
Thank you. Thank you for leaning in on that. I have another question that came in from our community that is attending, and we have a number of them that are watching not only on Zoom, but also, I believe, on YouTube on this evening. The question is, as was shared during the presentation, police agencies across the country are already facing staffing challenges. Can you share more details on how feasible it is to tackle the civilian and police staffing recommendations shared tonight? What is the feasibility of this recommendation?
Meaning the feasibility of having a civilian workforce or a civilian response? Yes. I think that we're already marching down that path with our partnership with Behavioral Health Response. We took an organization that had an existing workforce of licensed clinical social workers and other behavioral health professionals, and pretty much married them with our officer response. So we have a 911 diversion program where they answer if our 911 operators find there's someone in a mental health crisis that needs that type of response. And then again, they're there with our cops and clinicians program or crisis response unit. And they're all, and I'd say the best part of that is they actually follow up. So they have the staff available to follow up after the initial encounter and make sure that that person is on a pathway to get the resources and help that they need. So, it doesn't always have to be the city hiring additional staff. It could be that there's an existing organization that we can partner with and use their staff and expertise rather than building something from the ground up.
Thank you for that. I know that there are other national programs that are doing this. I know you refer to it as cops and clinicians. I know there's like the CAHOOTS program or the STARS program that I've seen in other cities. Have you looked into any of these other programs? Have you brought them in or gone to look at their programs to see how they could be similar, or brought some of their expertise into the city to see how they can perhaps overlap? As Jessica has shared with us, this is not the first time we're doing this. We have other people who are, we don't have to reinvent the wheel here.
I am definitely not a fan of reinventing the wheel. Nobody has time for that. So I happen to enjoy a great relationship with the mayor of Denver. He's like a brother to me. So when I got elected, I called him up and I said, hey, I want to come to Denver and see your program. And he helped us set up an entire day visit with the STARS program, as well as the Safe Outdoor Spaces program for their unhoused, because it's about trying to take care of those who are vulnerable. I think that is one of our directives as city government. And so, yes, we took a look at the STARS program and we're thoroughly impressed. We know that they have moved from a cops and clinicians response or officer or duo response to a total civilian response. I would love to eventually move to that, but that they also started the same way we did. So we're building that muscle over time, and hopefully we will be able to move to a total civilian response.
Well, I will make sure that Mayor Hancock knows that I had a conversation with you. He's also a very good friend of mine. So we're going to have to connect, because I think somewhere we're related. I really do. Somewhere down the line. All right. We have another question that came in from our community. And this could be for Dr. Isom or for Mayor Jones. I'm going to let you do the arm wrestling to figure out who wants to tackle this question. And it says, trust between police and the communities they serve is understandably very fractured in some communities. When you think about community engagement, how do you see those relationships shifting and improving? This is a big one.
I'll start and I'll let Dr. Isom finish from his, because he has more experience here. But what I will say is trust is something that's built over time. It's not something that happens automatically. And so we have to invest the time necessary to rebuild those relationships and convince the community to trust us again. And we have to do that by showing that we're trustworthy rather than just showing up. And like I said, it's something that we have to rebuild and have to work on over time. And I know Dr. Isom was here at a time when there were better relationships. And so I'll let him discuss the things that he did when he was chief, or how he thinks that we should move forward.
Well, thinking about the recommendations that the Center for Policing Equity have made, and Jessica spoke to it, I think people are really asking for meaningful community engagement. One, to meet people where they are. Oftentimes, we have these community engagement events that really are structured around where the police want to go, and not in natural spaces where the community might exist. And then we have to be open to listening to what the community wants and needs, and then responding to those needs. I think the other thing in the recommendations that really help with community engagement, but also community trust, is use of force. I mean, too much is given, much is required. And so we really need to be very focused on when it is absolutely necessary to use force. And when I say force, I'm not just talking about force in the most extreme sense. I'm talking about force in the most minimal sense. When you stop or talk to someone and engage with them, that is a level of force where you are preventing someone from their daily activities. And so we really need to be conscious of when that is absolutely necessary, because community people, all of us, understand from our perspective when it is absolutely necessary. And so, yes, we can make mistakes sometimes, but we need to minimize that as much as possible, because each interaction that a police officer has is an opportunity to create a lasting partnership or someone who has a difficult relationship with the police. And so, since policing is all about community engagement from every part, from calling 911 to serving on a jury, it's incredibly important that we do everything we can to build trust in every interaction we have with citizens.
Thank you for that, Dr. Isom. When I served as the Community Relations Chief Executive for the City of Aurora Police Department, one of the comments that I would always share when I was working with the community and with the police department was I would tell them, this is the only profession, such a noble profession, but it's the only one that I know where you only get one chance. You could go to a doctor and they could cut off the wrong limb, but guess what? There are going to be people signed up the next day to go see that doctor, that surgeon. This is the only profession I know where you only get one chance, but yet such a noble profession. And it amazes me that we have individuals who come back to work every single day. So thank you for the work that you've done. I want to ask Jessica to chime in on this same question because from that community perspective as well.
Yeah, I think one of the big priorities in order to increase that trust is to really listen to what community is requesting, to Dr. Isom's point. So when we've talked with community residents, they talk about wanting police to be partners in proactive problem solving in their neighborhood. If police are running from one call to another, they don't have the time to be proactive with residents. They don't have the time to get out of their cars and do walks through the neighborhood, which is another thing that residents have talked about, wanting to build that relationship with police. I do think one of the biggest things that we can do to build relationship, though, is for the police to be able to come back to community and say, these are things we've heard you want from us, and these are the changes that we have made. To be able to say we've listened and we've changed is a very powerful step, rather than just coming back and having the same kind of what would you like from police conversation over and over again. Really taking those learnings, acting on them, and then coming back to community and reflecting that back and getting input is really a valuable process in order to improve trust.
Wonderful. Thank you for sharing that. And I want to make sure everybody writes that down. It's almost a process that we go through at Courageous Conversation when we talk about mindful inquiry. It's not leading people in the direction that we want them to go. It's really listening to the community and saying, okay, we're going to listen to what you're saying, and we're going to go in the direction that you want us to travel in. So thank you for sharing that. The next question I have is for Dr. Menos. Dr. Menos, can you share some details on the evidence behind these policy recommendations, particularly those around reducing use of force?
Thank you, Claudine. I appreciate the question. So first, I think it's important to highlight that a lot of our recommendations are aimed at the idea that if we eliminate opportunities for contact, eliminate opportunities for police to interact with people unnecessarily, the force will go down. So pretextual stops and the banning of them, sending different responders or the right responders, as the mayor accurately stated, are all designed at positive outcomes, including but not limited to force. However, I think most folks might have heard we're co-founded by a social psychologist. All right, so a lot of the science that we talk about, and not just based on social psychology, but is rooted there. And the general idea, and there is evidence which we can post in the chat, or we can forward to the questioner later, is that there is evidence to suggest that when we constrain when force can be used, when we put guardrails, so to speak, around when an officer has the discretion or the ability to use force does go down. And a lot of our recommendations are really aimed at creating that good policy, which itself should constrain the use of force, but also building systems that can assess that via supervisors, via external oversight, using technology, including the body-worn camera, and understanding that. So there are there is a lot of evidence that suggests if we limit contact we can address all outcomes, including force. And if we have strong policies and that constrains the discretion of police officers, we can address these issues downstream. But I don't want to be disingenuous and suggest that it's just policy that does this. There are culture issues that are present. There are a lot of there's workload stress that's present. So the general idea that officers are more likely to use force and more likely to injure themselves when they are stressed is also evidence-based. So there's multiple streams in this report that undergird the idea that we can improve overall outcomes, including force, by doing a multitude of things that are some proactive, some that eliminate the contact altogether, and then some that are reactive in oversight capacity.
Thank you for that, Dr. Meadows. What I heard you say is there's no one right answer for this. There's a lot to this responding to this question. There's policies, there's cultural issues, and there's workload stress. And it's just kind of a layered response to how we could really address the use of force issue, right? And especially if you're taking into that perception, you have a snippet of what perhaps the media puts on television about here's the situation that happened. You have body worn camera out, hours of body worn camera film that you have to watch, but yet you just get a 10-second snippet or a 30-second snippet of what truly transpired during that whole time. And so there's a full story behind that. And when all of these pieces come out and come together, there's these multiple perspectives, that, as we like to say, that we really need to be layered in to really get that full story. Not saying everything is being portrayed as, when you talk about the truth, there's your story, there's my story, and then there's the truth. But we want to make sure that we are actually getting closer to that truth when we're talking about the use of force.
Yeah, absolutely, Claudine. I think that's accurate. I also think it's important when talking about the truth is to really understand whose truth has been respected over the years, over the decades, right? And so for people in Black and Brown communities, unfortunately, their truth wasn't respected. Their version of events was not respected. That's why we arrived at a point in 2015 where we started strapping cameras to folks. That's why we have multiple commissions and oversight agencies, because of this idea that Black and Brown people just were not being respected in terms of their point of view. So yes, we need the truth, but we also need to atone and recognize that the truth wasn't always valued when it came from certain people.
Absolutely. I would always say we have our own body worn camera now, right? We have cell phones that have given us a different level of information. All right, so moving on, our next question, Dr. Isom. How are the officers for the police department responding to the policy changes that are already underway? And how do you expect them to respond to these new recommendations? If you could share with us.
Well, I think the police officers really have embraced the diversion program, the co-responder model. As I said before, they recognize that many of the things that they have traditionally responded to, that they weren't particularly effective at. And so I think they're embracing those, and they are thankful that they are receiving some help, and that they're able to focus on the matters that they were hired for. What we're really talking about is being very focused and fair. And for police officers, there's a limited amount of time and resources to deal with issues that come their way. We want officers to be visible in the community. Many community people want that, to be visible, do foot patrols, but they also want problem solving. And what we're talking about is that the problem is not always solved by a police officer. There are other ways to solve problems. And when we do that, there's more time for officers to be visible, more time to do foot beats. And then there's an investigative component, of course, when that happens, and we need time to do that. But all of it is wrapped into developing that partnership and community engagement that we're talking about. So I think officers are thankful that there is a reimagining of police work. And this is not encroaching on their ability to do their job, but it's giving them a partner and giving another tool in the toolbox to handle problems that are not traditionally law enforcement problems.
Thank you. I want to pitch the same question to Jessica. Jessica, what do you see the community's response is going to be to these recommendations? Are they, have you been hearing that they are in favor of these policy recommendations? Lean in a little bit.
So I think that they do closely mirror, as I said before, what we've heard from community residents. We've come to some similar recommendations through different reports in the past. I do think one of the things that the city will have to wrestle with, or the residents will have to wrestle with, are some changing expectations from law enforcement. For instance, if there are staffing changes, while it may reduce the time that it takes a resident in North City to get a response from law enforcement, that time may mean that it takes slightly longer in South City, depending on staffing. And so we need to adjust what we expect from policing based on some of these changes. And then we also need to really lean into the bigger notion of public safety, and that community for decades has been wanting options for ensuring their safety that aren't just police related. And so this really gives an opportunity to community residents to help shape what that looks like through the implementation of these recommendations.
Thank you. So I love this panel because there's a lot of complimentary conversation, but there's also, like, don't forget, we're still paying attention to what's taking place with our elected officials and our appointed officials, because there are going to be some changes. If there's going to be a staffing change, that may mean something different for we're going to have to set our expectations. We are an instant gratification society, right? When I call Dr. Isom, I'm going to need you to be there right away. And if you're not there, then I'm going to call Mayor Jones to say, Dr. Isom's team wasn't there when I called. And here's the reasons why I think it was so important that you be there. Regardless, I, for one, have a family member where we have had to call we had to call 911 on occasion before. I have a daughter with a disability. And when I call, I am the most important person at that time. And so it doesn't matter what else is taking place in the community at that moment in time. I am the most important person, right? Because my daughter is in need. And so when we talk about that with our community, how do we set those expectations is going to be an ongoing conversation that I know this group is going to figure out through that recommendation of community engagement. We're going to figure out how we set that forth. Anybody else want to lean in on that before I pull up another question? Any other thoughts? All right. Let me go through some of my other questions that we had. I know, Dr. Menos, that we talked about earlier, some of the work that you all are doing. Are there other cities that you are working with that are enacting some of these same types of changes that we could learn perhaps from their efforts?
Yeah, certainly. So I think some of the cities we talked about already. So there's a lot of cities that are identifying around the country the idea that we have, as a country, become addicted to a punitive response, or addicted to a system of punishment as opposed to a system of care. And so we're seeing, you mentioned STAR and Cahoots and programs like that that have been doing this work for many years now, in Cahoots especially, that are really understanding that we need a different responder. Our partners in Ithaca, New York are identifying a responder that is not a frontline responder, that is a frontline responder that is unarmed, and that can report to a civilian director of that police department, of that public safety department. There are a multitude of other cities that are trying something to ensure that there are other options that are not solely police departments. Additionally, there are cities like Berkeley, California, and Philadelphia, where I am right now, are taking a special effort to remove police from low-level traffic enforcement, understanding that that is not improving public safety and just creating more opportunities for contact, which is something that they want to avoid. The state of Virginia as well has banned consent searches and And there's many other efforts to understand that officer discretion and the way that some police officers are doing their job as it relates to pretextual stops or use of force, or just the fact that they're present in spaces, needs to be reconsidered. So there's a ton of work going on, not all of it CPEs, of course, but a lot of it recognizes some core principles that we've frankly just become addicted to policing. As Dr. Eisen mentioned, we're often bringing police to places they don't need to be. And what I want to really pull out there is that while this is troubling for police officers, it's perhaps far more troubling for community members that aren't getting the service that they need. They aren't getting the responder that they're looking for. They're dialing a magic number, 911, so to speak, looking for help. And that the appropriate help isn't always showing up, or they're moving along their day and their movement is being restricted. For when it's not necessarily to be restricted, when public safety isn't improved because a police officer engages them around something hanging from their rearview mirror, or because they have some kind of other low-level traffic violation that needs to be addressed. So yes, there's a lot being done in the public safety space before and after the murder of George Floyd, and many folks are continuing to push forward in 2022 to ensure that they are being responsive, much like St. Louis is being responsive to the call of the people that they police and that they govern.
And I think one of the themes that we've heard throughout tonight is one, Mayor Jones, we definitely don't have to reinvent the wheel. There are people who are working on the same topic around the country. And we can learn from each other. We have connections, we have people who are doing the same work. And we want to be able to really share this conversation and say, okay, hey, what's working with your city? What has worked? Perhaps you're further along in some areas, but there's also some amazing things that is taking place right in the city of St. Louis that we could shine the light on and say, this is what's working for our community. Because as Jessica has said, our community has stood up and said, listen to us. We have a voice and we're enacting our voice, and we want you to listen to what, because we want it to be built for us. We don't want to take a binder off of someone else's shelf and put it and overlay it over the city of St. Louis. We want something that's specifically built for us. And I think that's what I see happening. So I'm excited to be a part of this conversation. We are at time. I want to give you some closing remarks. I want to thank each and every one of our panelists for your time, Dr. Isom, Dr. Menos, Jessica, and definitely Mayor Jones. We're going to have to hang out a little bit more because really, I think our paths have really crossed quite a bit. Thank you so much for your time. I want to close with this. First of all, thank you to each of you for showing up. You got involved. My screen, I have 3 screens going, and I just had questions just kind of floating by me. So I know we weren't able to get to every single one of them, but we are going to be able to give you a resource that it's being put up on the screen right now. Thank you so much for that. I want to make sure that I am saying all this information correctly, because my screen just went kind of berserk on me. But each of you showed up, you got involved, you took the time out of your day to really listen and lean in on this important conversation, because it impacts all of us. There's not one person that's here or not one person that you actually touch that it doesn't impact. So please don't stop showing up or speaking your truth. We need to go further. Like I said earlier, I kind of feel like that preacher. I am a pastor's wife, but when they say we need to dig deeper, tonight we're not digging deeper, but we're reaching deeper, reaching into our community. Each of you tonight are connected to a faith organization, a community organization, an educational organization, another civic organization, or I would say the most important, a youth organization. Our partners at the Center for Policing Equity have put up a slide with a contact for you to reach out to Rhonda Smith Branch, and the email address is there, and it's stlcommunity@policingequity.org. Again, that's stlcommunity@policing.org. The Center for Policing Equity wants to hear from as many of the organizations that I've listed and more. We have work to do. The great Audre Lorde is quoted as saying, to refuse to participate in the shaping of our future is to give it up. Do not be misled into passivity either by false security, they don't mean us, or despair. There's nothing we can do. Each of us must find our work and do it. Our work is in front of us, City of St. Louis community. Thank you for being here. We'll see you soon in the community. Have a wonderful evening and good night. Take care.
All right, great job, all. Thank you.
Thank you.
Thank you, Claudine. Great job.
Thanks,
Thank you, Mary Jones.
Much.
Thanks,
everyone.
everyone.
Thanks,
Mary
Jessica.
Jones, Michael Hancock is a family friend.
Oh my God.
My husband and my brother-in-law, my brother-in-law is his best friend actually, and they went to school together. So
Wow.
we go way, way back.
I just had breakfast with him maybe 2 weeks ago when we were in DC for National League